I'm Greg Wallingford, and I'm an emergency medicine physician, now palliative care doc at Dell Medical School. I studied at Notre Dame for undergrad, UT Southwestern in Dallas for medical school, completed my residency in emergency medicine at Stanford, worked at Penn Medicine in Philadelphia, and then came back to Dell Medical School in 2020. I worked at Stanford for a few years during my emergency medicine residency. Then I worked at Penn Medicine for 3 years in the emergency department. And for the past few years, I've been working as a palliative care physician at Dell Medical School doing clinical work, but also doing research and teaching. My research interest is primarily in how do we support people doing great work so they can do better. And to me, a lot of that is through well-being. How do we take care of the people doing the great work? How do we make sure that we create cultures that people are excited to work in so they can do their best? I believe students learn best when they're given a small amount of information, a chance to practice it, and then a chance to reflect. So generally when I teach, I give them a bite-sized chunk of information, a small group activity or individual, and then a small chance to reflect on it. When I'm not at work, I'm usually hanging out with my 2 kids, and when we get a chance, we love to travel. We're beach people. Health communication matters to me because how we feel affects how we perform. And I believe that communication is the single most powerful tool we have to support others doing great work.